everyone, and welcome. My name is Fiona Kyle, and I am the CEO of Mental Health Reform. I'd like to really warmly welcome you all here today to the launch of this really important piece of research. Before we begin, just some housekeeping. The Q&A function will be open, and we'll try to get to your questions as they come in. So if you have anything you want to ask, please do pop it in the Q&A. The full report will be available on our website after this, and hopefully that will also answer any additional queries. We're delighted to have two ISL interpreters present for this afternoon's launch. Catherine and Orla will switch around throughout the 1.5 hours this afternoon. So please make sure that your Zoom settings are at gallery view so that you can see the ISL interpreters. You can also enable closed captioning on your own device if required. We're really delighted to see such a huge interest and such a high level of attendees for today's launch. And as with any of our work, we wanted to remind people that sometimes these discussions and these topics can be difficult, and that support is out there. So I just ask my colleague just to put up a slide that shows some of the mental health services and supports that are available if you feel like you need to talk to someone. So you can see there some of the support that is available to you. So back to today's launch. I suppose many of us on this call are aware that, it's increasingly being recognised both globally and in particular in Ireland that many individuals in prisons experience mental health difficulties and have a range of often complex needs. And in recent years in Ireland, we have had a heightened focus on this particular issue, and this has led to some positive developments, such as the establishment of a high-level task force by Minister McAtee and Minister Donnelly. However, I think we are also aware of the reality that many individuals in our prisons are still not receiving the necessary support and services that they require. I think part of that, certainly from our perspective, is there hasn't been a good grasp or understanding of the range of services and supports available. So this report being launched today maps some of the mental health services and supports available in adult closed prisons. Mental Health Reform was delighted to have access to a number of prisons to speak directly to men in custody, accessing or trying to access mental health supports and services, as well as staff members providing services or providing access to the services. The report looks at pathways to services, the formal and also informal ways in which someone in prison might find out about the services, and then the barriers within the prison system in accessing appropriate and necessary mental health services and support. Our national mental health policy, Sharing the Vision, commits to offering a range of tiered supports to people in prisons, including social supports, primary care, and then the specialist mental health services. And findings from this report indicate that once accessed, mental health services can be a vital lifeline for men in prison who are experiencing substance use disorder and poor mental health. The perspective from lived experience really shine a light on many low-cost solutions and perhaps small improvements that could be made quickly and would greatly impact on the mental health of people accessing services. Just like in our communities, the importance of early intervention and prevention services offered by the community and voluntary sector should not be overlooked. The return on investment in this sector leads to much improved outcomes for people and better economic outcomes for the state. Addressing the mental health needs of the prison population can't just be done by one department or one agency. It requires coordination across a range of agencies, a range of government departments. That coordination is really a key piece in ensuring that we are really meeting the needs and putting supports and services in place. With that in mind, we invited Minister for Justice, Helen McEntee, to launch here today. And unfortunately, as you may be well aware, there's a lot of kind of competing demands, in particular this week on Minister McEntee, but we were delighted to receive a pre-recorded video message for this afternoon's event, which I will play now shortly. But before I pass over to the Minister virtually, I just want to go through the order of today. So after the Minister, my colleague and our research officer, Julia Corey, will do a brief presentation on the findings, and then she will hand over to her colleague, Bert Roken, who is our policy and research manager, who will facilitate a panel discussion with some really esteemed speakers, and I'm really looking forward to that personally. Then finally, our Mental Health Reform Chair and the Executive Director of Care After Prison, Michelle Kerrigan, will close us out. Please enjoy today, please ask questions, and please continue to shine a spotlight on the mental health needs of the prison population. Only by doing so will we create change. We all need to work together on this one. So I'm just going to hand over virtually to the Minister now. Fingers crossed that technology is on our side.
Good afternoon, everyone. Thank you for inviting me to speak at the launch of this really important report. We know that a large proportion of people in custody suffer from mental health difficulties and, as described in this report, psychosocial disabilities. Indeed, approximately 50% of the prison population are working with or are on the waiting list for psychological assessment and intervention at any given time. So addressing mental health is core to all rehabilitative work in our prisons. It is an essential part of ensuring individual well-being, and for this reason, it is essential that we have a complete understanding of how the prison environment and the formal support structures in our prisons support those who are struggling with mental health challenges. We must look at the individual lived experience of service users so that we can then better understand their needs. And by doing so, we gain meaningful insight about what works, what really impacts people's lives, and of course, what we can do better. When I speak to the people who work in our prisons, I see very clearly just how dedicated they are to the well-being of those in their care. And reading this report, it is so uplifting to see how this has meaningfully translated into the experience of those in custody. I was particularly moved by the way that some spoke about the supports that they found in our prisons. This is in no way to say that we do not still have challenges. We do, of course. There are things that we can and that we should do better. More is needed to help people deal with and to manage their mental health needs. But there is hope. Over the last number of years, in particular, there has been a real focus on how mental health and addiction interacts with our penal system. In 2022, along with my colleague Minister Donnelly, I published the report and recommendations of the high-level task force established specifically to consider the mental health and addiction challenges of those who come into contact with the criminal justice sector. In 2023, we followed this by publishing the Health Needs Assessment. It was the first comprehensive health assessment undertaken by the Irish Prison Service. The Inspector of Prisons has also undertaken work in this area. And what this report makes is a really significant contribution to this conversation. It offers real, independent and meaningful insight into the experience of staff and those in their care. Supporting people with mental health difficulties and psychosocial disabilities in our prison is not something the criminal justice system can do alone. It requires an all-of-government approach, an all-of-stakeholder approach. Departments, service providers, staff and, again, people in custody all need to come together, to work together to ensure individual needs are being met. I found certainly the holistic approach taken by this report to be particularly striking. We all know it is the little things in life that can make such a difference. We all know this. So seeing the emphasis on education supports, on access to physical activities, this, I have to say, was particularly welcome. We can create space that allows for and supports care and well-being, and it's so important in the prison context. That's what we're talking about here. I want to assure you this is something that I take very seriously. It's a key concern as we continue to invest in our prison estate, doing all that we can to ensure that it's modern, that it's fit for purpose, and above all, that it has the capacity to accommodate those and to support those who are committed by the courts. Needless to say, real change can only happen when we work and collaborate together. So I just want to finish by thanking you sincerely for your work on this report, and I look forward to working with you on the future.
Okay, can everyone see my screen now? Someone can just give me a quick shout if you can't hear me or see me. But so I also wanted to just first say thank you to everyone for joining us today. This report has been years in the making, and I'm really delighted to be able to share our findings and our recommendations with you. I'm going to do my very best to cover as much as I can in the next 20 minutes, so I'm just going to jump right into it. So first, I just want to give you a bit of background to provide a bit of context to the current prison landscape. There's more than 4,500 people detained in prisons in Ireland, and mental health difficulties and substance use are really common among the prison population. It's estimated that about half of people in prison in Ireland struggle with substance misuse, and more than a quarter with alcohol misuse. And there are a number of factors that can contribute to poor mental health, and this includes feelings of isolation, of boredom, drug misuse, reduced contact with family or friends, negative relationships with peers in prison or with prison staff, and overcrowding has also shown a significant impact on mental health. And as of February this year, 11 out of 12 of the adults closed prisons in Ireland were at or over capacity. So the aim of this research was to understand what mental health services and supports are provided across adult closed prisons in Ireland, and the pathways or steps that detained persons must take to access these services. And specifically, we want to know what services and supports are available, how people in custody become aware of the services, how they become aware of the steps needed to access the services, what those steps are, and then finally, any potential barriers or challenges that they might face when trying to access the service or support. And we used mixed methods to carry out the research, and this included a 10-part survey that was distributed to prison staff about the services provided, as well as qualitative focus groups and interviews from key stakeholders. And we spoke to a total of 21 prison staff, 5 staff working in the voluntary and community sector, and as well 12 men in custody in order to hear their perspectives and their experiences. And where there are any gaps in the data, we use desk-based research to help paint a fuller picture. And just to note as well that we decided to limit interviews with people in custody to men. And this was only because there was a similar piece of research that was being carried out in the women's prisons by one of our brilliant steering group members, Anne-Marie. And we didn't want to duplicate work or for any of the women to feel their voices were not heard the first time around. However, staff working in the women's prisons were invited to participate. So now just on to the findings of the research, and just to say as well that this is very much a whistle-stop tour of the report, and you know we can't fit everything into the presentation, so I'd really encourage you to take some time and have a read through the full report, and especially to read the reflections and the quotes from those with lived experience. So we found a wide variety of services that support mental health, both directly and indirectly. We grouped these supports into 4 tiers based on the level of mental health support provided. And this was inspired by our national mental health policy Sharing the Vision, which outlines a tiered approach to mental health services across the country. So non-specialized low-level supports were classed into tier 1, those at the primary care level at tier 2, specialized services and supports in tier 3, and then finally we have specialized inpatient services at tier 4. So to take a closer look at tier 1, in this tier we have education services, which offer general academic and life skill courses, as well as some mental health adjacent courses like mindfulness or yoga. And then we have psychology, psychoeducation services, and these are once-off workshops that are open to the whole prison population to attend, and they can cover a variety of topics. So some examples would be grief, trauma, or self-esteem. The voluntary and community sector services, we found more than 20 services that help provide support to persons either in prison or upon release, and the full list of these services is in the report. We also have chaplain services, and these were really seen as a valuable service, particularly for informal emotional support. A lot of participants said that the chaplains are often walking around the prison landings every day, and they're there for anyone who wants to have a chat. The prison TV channel also came up quite a bit, particularly as a resource for information. For example, about things that are happening in the prison, where they can find psychology service and that sort of thing. And there's also a few mental health resources, things like mindfulness on the TV as well. And so I just wanted to talk a bit more about the education services here, because they really came through as an important resource for mental health, and particularly around getting into a routine and building self-esteem. The men spoke really, really highly of the teachers in the schools and the relationships that they built with them. So on the left, you can see one of the men said, "The teachers taught me more about myself in terms of manners and respect. They really care about their students, often going out of their way to make sure my assignments were in and on time. And they go out of their way a great deal for the lads to help the lads." And one of the challenges with accessing the school, I just wanted to note, was the operational short staffing, which can lead to the school being closed or partially closed sometimes, which of course would disrupt routines and have an impact on mental health. I also want to highlight the Mental Health Week, and this is a week-long series of workshops and speakers that's hosted by the school prisons, prison schools, that is focused on mental health and well-being. And this happens once a year, and it's open to the entire prison population. And I can tell you that every single one of the participants that we interviewed who spoke about the Mental Health Week spoke really, really positively about it. A lot of the men told us how it helped to break down stigma. It increased awareness about mental health and the services that are available in the prison. And some of the men were saying that it led to really positive conversations with their peers about mental health that continued on for weeks after the events had wrapped up. And the men really expressed interest in having Mental Health Week be run more than once a year. So on the right side there, you can see one of the men's quotes. He says, "The psychologist done a workshop in Mental Health Week, and that was the most powerful. I got a lot from that, very, very powerful. I've told a lot of people about it, and then it was at that stage that I put my name down to see the psychologist." Now to take a closer look at the voluntary and community sector services. It was really clear throughout the interviews that men in custody really valued the services that were led, especially by those with lived experience of prison. So on the left, you can see a quote from one of the men who spoke about a service. And he said, "What I felt with him, he was a prisoner before. He was in an old prison. He turned his life around. He knows what's going on inside. I was able to go in and trust that I was able to go in and trust what I was going through, and that he could see what I was going through." I also wanted to put a spotlight onto the Samaritans listener services, who provide a non-judgmental ear to anyone who needs to talk. The Samaritans train people in each prison to become peer listeners, and this service was particularly viewed really positively. As one of the GPs said, "I think it's actually really good because they tell their colleagues things that they wouldn't dream of telling us." And then one of the challenges that came up in relation to the Samaritans specifically that I wanted to flag was around language barriers. The peer listeners, we were told, are predominantly English speakers that don't have a second language. So some of the men especially felt it would be important to recruit and train peer listeners with multiple languages in the future to improve support for people who are in prison who aren't able to speak English. It was also really interesting to hear about some of the additional informal and indirect supports that came up. And so a lot of the men, especially that we talked to, brought up the prison gym as a sort of outlet and a resource that helps them to build a routine and build self-esteem. So one of the men, you can see on the left, he says, when I was suffering with the paranoia and the depression and all, I was taking loads of drugs. When I'm suffering now, I try to go to the gym, do something, feed your problems by doing fitness or by doing a couple laps walking in the yard. And similar to the school, though, short staffing can also impact access to the gym. And then peer support as well was really seen as invaluable by both the staff and the men in custody that we spoke with, and particularly as a way to raise awareness of services and to help normalize accessing them and trying to also lead others by example. So one of the men, when he was talking about a mental health workshop, he said, with me there, I'd go back. I'd see a few fellas. I'd say, I heard that there's a group on Thursday. It's brilliant. You'll get an understanding of it. I says, it worked for me. I'm not afraid to fucking say that. So moving on to tier 2, which includes primary care services and supports, we have GP and nursing services, as well as primary care psychology services. So GP services would be similar to what you'd find in the community. They can provide prescription medications and refer on to further mental health services where appropriate. Nurses also have a hand in providing health assessments and triage and referrals. So one of the things that really came through in the interviews was the relationships that nurses often build with people in custody, because they would be on the landings every day to distribute any medications that someone needs. And so they actually get to know the people quite well. So as the GP says there, the nurses know the guys really well because they see them every day. The nurses are very good at picking up when one of them is a bit off. A lot of the nurses are quite motherly, so sometimes they just say, listen, let's go down to the surgery and we'll have a chat up to you and see what's up with them. And then in terms of the psychology services, we'll get into some reflections on that in a few slides, but at the primary care level, interventions will generally be shorter term and for more mild to moderate mental health difficulties like anxiety or depression. So now to look at tier 3 services, which provide more specialized services and supports. So here we have addiction services, which would include drug maintenance or detox, as well as addiction counseling. Emergency Ireland came up quite a bit as being one of the key providers of addiction counselors in the prisons. We also have a tertiary, secondary and tertiary level psychology services, and these would generally be longer term interventions and would support more enduring mental health difficulties like trauma or personality difficulties. And psychiatry services are also offered via in-reach services from the National Forensic Mental Health Services or the Health Service Executive, depending on the prison. And they would provide specialized treatment for more severe mental health difficulties like psychosis or suicidal thoughts. And then the mental health specific infrastructure, some prisons have dedicated mental health landings and high support units or safety observation cells. So when we asked participants about their experience accessing or trying to access psychology services, the vast majority really spoke positively about the services once they were able to get into them. The men really seemed to value the services. I think it was a GP that had likened it to going to the gym, saying that the men really enjoy getting into the routine of going and seeing themselves make progress with it. And that was echoed by a lot of the men that we spoke to in custody. And as you can see there, one said, and with the last 12 months, I'm more into it anytime I get called. I get into it more and I love it. I'm getting something out of it now, and they're after explaining to me what it's about and how to deal with your emotions. And then the big challenge that came up in relation to psychology services was the waiting list. And some people, are waiting up to a year or longer to get into the services. And as you can see there, one of the men that we spoke to waited about 3 years. And both the backlog from COVID lockdowns and the difficulties recruiting psychologists were acknowledged as contributing to the long waiting lists, but the operational staff shortages were also brought up quite a bit because, the psychologists might be available and waiting in the prisons for appointments, but without the security detail, they aren't able to actually hold them. So that last quote there says at the bottom, "I'm here for a full year and I've seen psychology once. It's understaffed. You need a prison officer or two out there waiting. That's understaffed as well. People have sick days. Obviously, COVID kicked in, which drove everything haywire." I've pulled out some quotes here on addiction services as well. So most of the men shared really positive experiences with their addiction counselors and really valued the relationship that they had built with them. And again, that routine of going a few times every month. And so the first quote really highlights this. One of the men said, "He's very good. He'll call you out. He'll call you over maybe twice out of the month. He'll have you in his room. He'll just talk away with you. He's actually good now. He takes your mind off of things. If you had a bad week, when you talk to him, you'll come out smiling." And then similar to psychology, the big challenge here is the waiting list. One of the nurses had said, "We have 2 counselors, but they'll also tell you that their list is endless." And then quite a few participants, both detained men and staff working in the prisons, highlighted the need for a dual diagnosis model of care to access, addiction and psychology services in tandem. So the last quote at the bottom says, "It's the dual diagnosis. It is addiction and mental health. You can only have one or the other, and that is a serious problem. Your addiction counselor will deal with your addiction, and once you have that dealt with, you can see a psychologist and then work on your mental health." So then lastly, now here we have Tier 4 services, which in this case is the Central Mental Hospital, which is now located at the National Forensic Mental Health Services in Portrane. The Central Mental Hospital is the only approved center that can provide inpatient mental health care for people in custody experiencing significant mental health difficulties. And unfortunately, we weren't able to speak with anyone who had accessed the service, but some staff did note some challenges around, long waiting lists for the Central Mental Hospital and the need for collaboration between the services and IPS for people who need care in an approved center, but also have significant security needs. So now moving on to the pathways to accessing the services now, and this is very much a broad overview, and more specific information can be found in the full report. But generally speaking, people became aware of the services and how to access them from informational material, like notice boards or the TV channel or brochures that are dropped around the prison. And then they could also become aware of it through peer interactions, and that could be from word of mouth or from observing others accessing supports. Or actually, there are some people in custody that are trained up to become Red Cross volunteers in the prisons. And so then they will go around and inform people about events or workshops that are happening in the prisons. Staff interactions were also really common, a common way of learning about the services, and in particular the role of prison officers came up quite a bit because they are ultimately the ones who are on the landings with the lads every day. So they would get to know the individuals quite well and be a really important resource. And then, to actually access the services themselves, this was often through formal, informal, or self-referrals. So for example, some of the men told us that anyone who wants to access the school or even psychology services just needs to put their name down on a list for it. And that can be done themselves or by asking a staff member or one of their peers to put down their name for them. So just to give a small overview of some of the key challenges that came up. Some of the long waiting list was obviously one of the biggest barriers to accessing the services, and understaffing, as we know, has been an ongoing challenge, particularly for areas like psychology. But that's across the community sector as well. However, the short staffing of operational and security staff due to staff sickness was also a big challenge, which caused services like school and the gym to be closed or partially closed quite often. And as I said earlier as well, that this can impact waiting lists for things like psychology and addiction services as well. Language barriers came up quite a bit. One of the GPs had actually given an example. He said that often the lads, they might ask their peers to translate for them and tell the doctor about their sore back, but they're much less likely to go to their peers and to be translators to discuss their mental health difficulties, just because of the stigma and the self-stigma that's attached to it. And then overcrowding again. Oh, I'm just going to pause to let the translators switch over. All right, I'm just going to go. Am I okay to continue? Okay, perfect. So overcrowding, again, contributes to long waiting lists and having people doubled up in cells or with mattresses on the floors really has negative impacts on their mental health. And then we have dual diagnosis again, which we already covered. Being prepared to go into the prisons came up quite a bit. A lot of individuals and their families found their first time, especially coming into prison, to be quite a shock, not knowing what to expect, what they can and cannot bring with them, and then what services are available. And then the awareness piece, a lot of men felt that there was a need for increased awareness about mental health generally and about what services and supports are available. And they felt that increasing awareness would also help to reduce stigma. So getting into the recommendations, which we have a lot of, so I'm just going to get right into. So we have 3 policy and legal recommendations. So the first is to align the Irish prison healthcare standards with the UNCRPD. We also would recommend ensuring that legal rights, including those under the Assisted Decision-Making Capacity Act, are extended to people in custody. And then also to ensure that prisons are implementing learnings from the COVID lockdowns. And this includes making sure that people who are isolating with an infection have access to showers and to hygiene, and that all prisons are meeting health and safety authorities' indoor air quality guidance for ventilation and filtration, as this will help to reduce sickness among both staff and those in custody. And then we also have quite a few operational recommendations, so I'm just going to touch on some of them. So while some of these would be medium to longer term recommendations that would require investment, like developing a framework for tier mental health supports in the prisons, increasing resource allocation across all tiers, and implementing a dual diagnosis model of care. There's also like a lot that are really short-term, low cost, and really tangible changes that can be made and bring a really positive impact to mental health in the prisons. So like that, doing something similar to Mental Health Week with the voluntary and community sector services would help to increase awareness and accessibility of those supports. Making sure that every prison is distributing information leaflets about the services that are available in their specific prison. We know some prisons are doing this, but it was clear that not every prison had this. And then like that, making sure that leaflet is available in other languages, and again, recruiting multilingual peer listeners for the Samaritans will be really valuable. And then going back to the shock factor that many people have coming into prison, wherever it's possible to be able to provide pre-sentencing guidance on what people and their families can expect going into prison would be really beneficial. And then increasing the numbers of psychosocial education workshops and psychoeducation workshops and holding Mental Health Week more often would have a huge impact. And it would also help to, make sure that, more people are able to access at least some level of mental health support during their sentence. And it can also be a level of support for the people who are on the waiting list, for psychology. So we go into a lot more depth on these recommendations in the report, so do go give it a read. But in the meantime, I know we have lots of interesting panelists that we'd love to hear from. So I think I will just wrap it up here and hand over to Ber for the panel discussion.
Thank you so much, Julia. So I think we're going to stop screen sharing now, and I'm going to be joined by our lovely panelists. So we have John, James, Sarah, Karen, and Kathleen with me. And just for ease of viewing of the ISL interpreters and ourselves, if people on the top right-hand corner, it says view, and you should be able to click there and put it as gallery view. Ideally, that will work best, so then you can see all of us. And Catherine is interpreting at the moment, and then we'll see Orla when she switches over. Thank you so much to Julia. I know that was very fast, and it was very much a whistle-stop tour of the kind of main pieces that are in a very, very dense report that we have. And just to say, we're trying to, myself and some of the other mental health reform team, you know, there's questions coming in and messages and texts and things like that. So hopefully all the tech is going to continue working nicely for us. And you know, just fingers crossed, and if we can't get back to you on anything, just do drop us an email at info@, and myself and Julia will do our best to get back to you as quickly as possible. So you don't want to hear much from me. I'm only going to be asking the questions. I'm so excited to hear from our panel today. So we're really delighted to have two experts by experience with us. John, who's a member of our grassroots forum with mental health reform, and then James, who is based in Cork and is a community activist and expert by experience. And then we're also delighted to have Sarah O'Toole, the Executive Director of Samaritans Ireland, which are a member organisation of mental health reform, Kathleen Lynch, the Chair of the High Level Task Force, and Karen McCaffrey, the Director General of the Irish Prison Service. So what the plan for this part is, we have about a half an hour, 40 minutes or so. So we'll keep it as this gallery view with everybody. And I'm going to come to John first for my first question. So John, as one of our grassroots forum members with mental health reform, you've done quite a bit with us, and you did get a preview of the report. Is there anything that jumped out at you from the report that you found surprising or that you weren't expecting?
Thank you, Bert. Yeah, I was privy to have a little look at the report beforehand, and I think firstly it was fantastic work that's been done there, first of all. I think from when I read the report, what kind of came back to me and jumped out was the importance that still resonates around the educational piece, particularly the impact it has on the mental health and well-being of individuals that are incarcerated. I was actually glad to see that progress has kind of been made from the point of view of technology, that the TVs are now being used themselves to deliver different messages and different modules that are there. I'd be interested to find out a little bit more around that and what they're doing. That's the positive aspect of what I've seen in relation to it, and I think it's very important to understand the impact that the schools and the educational pieces have on individuals that are incarcerated. It's not just a course that they're doing, but it's a way to communicate, a way to kind of engage with individuals, and kind of an escapism from where they are at that moment, and that continues to resonate on that aspect of it. I suppose one of the other areas that kind of jumped out at me, which was a little bit disappointing to read and see that still there, is the poor access or the long waiting lists that continue to be there in relation to accessing mental health, from the psychotherapy, from the counsellors aspects in relation to that. And I know that individuals serving a shorter period sentence, like up to 12 months, you know, their access to mental health there really would be very, very, very limited from where they would be, which I believe continues to attribute to levels of recidivism, which is another area that I know that will be looked at maybe at some stage. But they're the kind of main key points that jumped out at me when I read that report. There was lots more, but I just decided to narrow it down to those at the moment.
Thanks so much, John. And from your own experience, was there anything that kind of personally resonated with you, or kind of, you know, like hit that emotive response for you reading the report?
Yeah, when I read about it, there was quite a number of different areas, actually, to be honest with you. It kind of brought me back to when I was, you know, back in that scenario. But I think the daunting task of being underprepared I suppose when you're going through the judicial system and getting ready for your sentencing. In my case, obviously, I had admitted my guilt, so I knew what was ahead of me. But even at that stage, you're still kind of underprepared, and very much underprepared as to what the next step is when you go to your committal jail, which would have been Mountjoy, and then moving from Mountjoy to Wheatfield Prison. You know, you move from a single cell to a double cell, and then you're like going, you know, what all those questions that you've thought about in your head, that you're trying to make up answers to, you know, they're not the answers that are there when you get there at the end. So I suppose some clarity for individuals around that, you know what I mean? And I think it kind of moves just beyond the individual themselves. It moves to the greater impact of what it has on their family and their own mental health, and the anguish and the levels of stress that's incorporated with their son moving into a prison in that environment, you know.
Thanks, John. And it's a really good point. And people who read the report, the full report as well as the exec summary, will see that actually one of the pieces says, you know, that there's too little information on committal, but then sometimes people can feel overwhelmed. So it's really about choosing the timing of giving that information. James, I'm going to come to you next. Is there anything in particular that resonated with you from your experiences over the years?
Yeah, I suppose the education piece as well. A couple of years ago, I led out on a addiction studies course with UCC, Adult Continuing Education. We brought into Cork Prison, and initially it was a certificate of attendance, and now they get actual university credits, which is amazing. But in the report, I could see the barriers that people have access in education. One of the interviewees was talking about you could be in the middle of your leaving cert and the school is closed for a couple of weeks because there's no staff. I remember when we were doing the course, you would have guys that would be probably attending a course for the first time since they had bad experiences in school, and you're trying to, you know, they're on a different life trajectory, or at least you're trying to get them on a different life trajectory. And 3 or 4 weeks into the course, out of the blue, they're transferred up the country to another prison, you know, without warning. And that's very disheartening, you know. So a lot of the stuff in the report is probably stuff that if you're in and around the prison, you probably know, but it's great to have objective research here now when you're making your arguments. We have it, the paper. So just congratulations to everybody for actually doing that. It was great to see the Two Norries podcast cited a few times. You know, we created podcasts to highlight people like myself, Timmy, and people like us, to give them a platform. I think it was so positive, so positively received inside, because they don't have anybody in the media really that they identify with or that has walked in their shoes that they look up to, and all of a sudden we provided that. We just laid out our pathway through the systems and through recovery, and there's more than one way to turn your life around as well. So it's not that I have the silver bullet for assistance and recovery, or Timmy. Everybody is different, and what worked for me might not work for the next person. So it's important to show people the different methods, and as well, it was the creativity of using a prison TV channel, the way we can access thousands of people in one go. It can be a holding space for people that are waiting on, and not a substitute for a psychological service or an educational service, but feel like that they're getting some sort of a service while they're waiting for it. You know, so I look forward to maybe down the line collaborating with the Department of Justice and the Prison Service again. Starting a new kind of project with my wife Gillian, who's also formerly incarcerated, and I think, looking from the report, there is a demand for it, and it's received really well.
Yeah, that's brilliant, James, and that's why I was trying to get in touch with you to speak at the launch with us today, because it was really great to hear, you know, about the importance of peer experiences being brought back into the prisons. And just on that, like, how important would you say that peer support is within groups who have experience of prison or addiction?
Well, I think that if you have a psychologist that has amazing education and experience, you can't replace that. But somebody with lived experience can complement it. So one of the things I was doing with the prison service was I was co-facilitating a group for a violence reduction group with a psychologist, and we bounced off each other well, and some of the practical stuff and some of the lived experience queries and questions are parts of the course. I could help with some of the more technical, in-depth psychological, the psychologist there. And I'm part of an international network of formerly incarcerated leaders. And last year, myself and Karen and her colleagues, we presented at an international corrections and prisons conference. And for the Irish Prison Service to collaborate with people with lived experience is novel it's actually unheard of really on an international scale really. So it's encouraging and it's thinking outside the box, but that's what needs to be done.
Brilliant. Thank you so much, James. Karen, I'm going to come to you next. So thank you so much for being here. I know you're all really busy. So just the importance of tier 1 supports and the non kind of mental health specific staff are highlighted in many of the contributions in the report, such as teachers, as we've heard here today as well, and prison officers. Can you talk to us a little bit about those kind of supports and that staffing within the prison system?
Sure, Bert, thanks very much, and thanks for the invitation. If you don't mind, I might just start by thanking Mental Health Reform for undertaking what is a really valuable and a missing piece of research, within the prison service and the criminal justice system. And I can just certainly give a commitment that whilst today might be the end of your role, we're now starting to give proper examination to the recommendations, and we'll be working as best as we can to implement the recommendations. And I think it's important to say, while I don't have time to go into all of them, many of those recommendations are already in train. So I can certainly give that assurance. I also just wanted, I suppose, maybe to say that whilst there's lots of positives in the report, there are challenges. And I think it's important that I acknowledge those challenges. So overcrowding, as we all know, is a specific and an increasing challenge within the prison service. And we know the negative impact it can have on an individual if you're sleeping in an overcrowded cell, if you're sleeping on the mattress on a floor of somebody's cell, if there are insufficient services to allow you to access, on a daily basis. We know that can, have a really detrimental and negative effect on your overcrowd, on your mental health. So that is, really, really unfortunate from our own perspective. There is a capital programme where we're delivering short, medium and long-term additional prison spaces. And I think that's really important. And we've recently gotten additional investment to support us in relation to that. I think the report references, and many of the people with lived experience in the report reference the limitations in relation to service provision. So obviously when we have overcrowded prisons, we have more people required to attend to court. We have more staff leaving the prison every day to do escorts and been taken away from those really important tier 1 services within the prisons. And we've been doing a lot of work within the prison service to ensure that we can give as much access to services as we can, including putting a very significant amount of additional hours within our system to support the opening of services. And it's not lost on me, the negative impact where services can't function, where people can't access their school, and James mentions that himself, where people can't access their psychologists. Again, one of the challenges, the absence of a dual diagnosis service, and that's absolutely acknowledged, but just to reassure that we are working with our colleagues in the HSE in that regard. It's unfortunate that you weren't in a position to map fully the tier 4 supports within the system, but I can assure you that we're continuing to work with our colleagues in the National Forensic Mental Health Service and the CMH, because issues still do exist, unfortunately, in terms of waiting lists to access services, and particularly waiting lists to access beds in the Central Mental Hospital. And then I think one of the points that was really well made by John is just about how daunting it is to be committed to prison. So just to let you know that we completely acknowledge that, and we're just putting the final touches to a virtual 360 tour that's been developed both for people who will be committed to prisons, but also really importantly for the family of people who will be committed to prisons. So you have absolute clarity and certainty of what to expect, what the processes are, what the stages are, and importantly then what the services are. So if I now answer your question, very sorry, around those tier 1 services, I mean, it really comes across throughout the report how important the services at a prison level are, from our psychology services, from our education services, our chaplains, our work training. And I'm really, really proud of the services that we do provide, both directly provided by the prison service and by community and voluntary and other statutory agencies who work within our prisons. I think for me what comes across really clearly in the report is just how important the role that's played individually by everybody who lives and works within our prisons in terms of supporting each other's positive mental health. And I'm really grateful, for all of the work that's undertaken, both by peers within the environment within which they live and by our service providers. In terms of our prison staff, I think it's recognised that prison staff, and the report recognises this, spend the most time on the landing with individuals, are in the best place, I suppose, to assist people in relation to the mental health, to identify where somebody may have an issue, and really to signpost them to the services. So we invest a lot of time and energy in training our new recruit prison officers and our existing staff in terms of mental health awareness, and that's really, really important. In terms of teachers, employment and resettlement officers. I know we have care after prison here. There are lots of great services, and those service providers bring their expertise and their experience into our prisons, and we're really grateful for that. But I do think there's more we need to do in terms of training and assistance in relation to the people who are coming within our prisons to provide our services. But just to pick up on John and James's point, what we know is that the peer-led approach works best. And I suppose James mentioned that actually Ireland is a leader internationally in relation to what we're doing in terms of peer support. And the Samaritan programme is a programme that's been in operation within our prison system for over 20 years. We've been building on that with the Red Cross programme, and we're now working on a recovery programme, which will be a peer-led recovery programme, again meeting one of the recommendations to deal with both recovery from addiction and from mental health. So certainly from my perspective, those tier 1 supports are absolutely critical, and I'm really, really proud and grateful of the support that's given by the staff who work in our prisons every day, by all of those in-reach services, and really critically by the people who live in our prisons, who've been through the system and who provide really great peer support to each other on a daily basis.
Thanks so much, Karen. That was brilliant, because you've touched on a couple of our recommendations as well. I know there's a recommendation there about the dual diagnosis programme, and it's also a lovely segue into Sarah and my question for Sarah and the Samaritans. So the Samaritans are spotlighted in the report, and obviously did come up a lot, even around peer listeners and the programmes within the prison. So can you tell us a little bit about the role of the Samaritans within the prison system across Ireland?
Great, yeah, of course, Claire. And just to say as well, thanks for inviting me along today, and congratulations on this report. I think it was much needed, and it's also brilliant to see such a huge attendance at this event today, over 100 people. So yeah, a very welcome day, I must say. In terms of what Samaritans do in the prison context, as Karen said, we've been operating the listener scheme prisons across Ireland over 20 years. We started off in Cloverhill Prison back in 2002, and today we have over 130 listeners across 15 prisons in Ireland, and they are supported by 60 of our volunteers spread across the country. And it's a really important service that we provide. It's a real tangible piece of work that we do. And listeners are there as peer support for prisoners, helping to reduce the incidences of suicide and self-harm, and providing that emotional release for those who are in distress. So we know from our research that prisoners struggle with many issues that we all struggle with day to day, issues around family, around mental health. And in particular, we find in prisons, for those who are first time in prison, it can be a real shock to their system, a real shock to their mental health. And they really struggle to cope with that. So last year we recorded over 2,600 contacts to our listeners in prisons across Ireland. So that kind of demonstrates the demand and the need for the service there. Our volunteers visit prisons on a regular basis to support the listeners, also in their own for their own emotional support, because they are providing that non-judgmental, confidential listening ear 24 hours a day, as and when needed, to their fellow prisoners. So our volunteers go in and they select and train and support those listeners, and it's an incredible program that we have. And I think that the key to it is that peer-led support, and providing something that, I think, as James alluded to, providing that guidance, that training, etc., but also having that peer element to it just makes it a lot more authentic and accessible to people. Another piece that we provide is our helpline. So our 116123 free phone helpline is available through the in-cell telephony network in prisons. And we have seen, traditionally, those calls would have been made from the landings in prisons. So we've seen, since that in-cell telephony was introduced a number of years ago, our demand for our helpline has increased at least tenfold. So last year we answered 20,000 calls from prisons across Ireland. So it kind of demonstrates the need for it. And we're working very closely with the prison service to address that demand, to make sure we continue to be available for prisoners. I must commend Karen and her team the level of collaboration and inclusion for Samaritans within the prison service and addressing these issues has been exceptional. And Karen's really leading by example on that and leading the way. Karen mentioned the prison staff, and we also provide training and awareness to all new recruits. So anytime there's a set of new recruits coming out, we can go in and talk to them about just being aware around the issues around suicide and mental health, and for themselves as well. You know, it can be a struggle too for the staff within prisons. We know that. So yeah, that's all about Samaritans in prisons.
Yeah, and just, I suppose, following on from that, you know, what do you think is the importance of the community and voluntary sector in general in providing mental health services and supports across the prison services across Ireland?
Yeah, so I think the role of the sector is really important. And I think what we do is we provide that gap between what's outside available to the general population and to what's available in prison. So we know that people who are in prison are a marginalized group already. So I think that's really important to meet that gap. We also understand that staff in prisons are very busy. They're called on for across many different areas, whether it be escorting or for committals or whatever. So we understand there is that gap there to provide that support. And we think the listener scheme is that real vital lifeline to people in prison. Samaritans, I think, brings that expertise, experience and knowledge into prison and embeds it there with the listener scheme, and providing that structured training as well as another important part. So I think it's great that, you know, there are the resources in-house in prisons, but also being able to get access as well and to provide that service is really imperative. And I think what we see with the rise in demand of calls to the helpline, it's still very much needed. I think there's areas where we could improve, certainly, and it's really been interesting to hear those recommendations around the inclusion in terms of the multi-language piece, around the diverse population that we have in prisons now. We've already been talking with the prison service about this, looking at even a first step, maybe providing some of the materials we provide in different languages. As you know, Samaritans is an English language helpline. So for us to be able to support, we need to make sure that we have addressed those language pieces to make them available. It's an issue we have as well outside the prison piece that we're seeing, but that's certainly something I think we can do in prisons to even start addressing that.
Yeah, brilliant. And I think that's a really good point. It's not that this is happening within the prison system in Ireland. It's reflected and mirrored in our mental health services and supports across the country, you know, that we do need access to materials and support in different languages and culturally appropriate, or even training around LGBTQI plus people, you know, all within the mental health services. And that's why it's great to link in with Sharing the Vision, our national mental health policy, and all of the recommendations that come into that. We've kind of touched on a couple of things around the different bits and pieces of work that have been happening. And Kathleen, I know you might have to run off before the end, but thank you so much. And our other Cork contingent here today, Kathleen, as chair of the high-level task force for people with mental health and addiction challenges who've been in contact with the criminal justice system, can you tell us a bit about your learnings as part of that task force at the moment? And just to say as well, you know, that our piece, you know, is a small kind of piece in the gap, in the jigsaw of all of the wider parts that will be coming together, hopefully through the Department of Justice and the Department of Health. But yeah, if you could just speak to us a little bit about the high-level task force and your learnings there, Kathleen.
Thanks very much, Fiona. I'd like to congratulate you on the report. I think that, before I go any further, could I congratulate Karen as well? It's seldom enough in such a male-dominated profession that we see someone that clearly has a huge handle on our brief coming to the fore. And I'd like to congratulate her, and I know that will bring with it a change of attitude as well, and hopefully all of the things we speak about today, they can't all be priorities, because then nothing is a priority. but there are certain priorities. I suppose your report doesn't tell me anything I didn't know, or those of us who have been involved in the areas, but what it does is that it brings a further illumination to the issues that prevail. I suppose in the first instance, I thought very long and hard before I took on the task of chairing the high-level task force, because I knew that we were dealing with three groups of people that were heavily stigmatized, and where there was very little either empathy or sympathy for these groups, whether it's in relation to addiction, whether it's in relation to mental health, which I'd worked with significantly before, and or then people that commit crime, whether as a result of both of those issues or none of those issues. So we really were looking at three groups of people that I believe have been marginalized and ostracized for so many years. Yes, they've always been people that have been desperately working to improve conditions, but nevertheless, that stigma still exists. And I think whereas you might be stigmatized because of your mental health issues, being stigmatized because of your mental health issues and then being incarcerated as a result of that condition brings a further stigma with it. And we were very conscious of that sitting around the table. I would say that the Department of Justice were very courageous in taking it on. They gave us as much time as we needed. We sat for a year. We had approximately 30 people around the table, all very committed to ensuring that we would get a gold standard when it comes to how people with dual diagnosis are treated when they come in contact with the justice system. And I would just like to tell you some good news, because the dual diagnosis issue was one that we spent a lot of time on, and really, and I think I can speak for the 30 people that sat, 30 people plus that sat around that table, that we really dug in our heels on, and that is that we now have a clinical national lead for dual diagnosis. And it was launched in May last year, and there have been 3 sites already identified and are being worked on. James, you'll be glad to hear that one of them is Cork and Kerry, the other is Dublin, and the other is the Midlands, but they will have to be staffed. And as we all know, getting appropriately trained staff is a difficulty in all areas. We did ask, one of our asks in the task force was that one of the teams would be located in a prison. We felt that would be appropriate, and we're still hopeful that in the future that will happen. But the fact that we now have a clinical lead for dual diagnosis is a huge step forward, because we all know, and you say it in your own report, you could be treated for your mental health, you could be treated for your addiction, but you couldn't be treated for the two together. Now that's going to change, so thankfully. So that's one of the things we dug in our heels on, that we knew, we were very clear that we knew what was going on. But the other issues in relation to, for instance, the Central Mental Hospital and drug addiction, whether that drug be alcohol or whatever, and mental health, was that the Central Mental Hospital had been full capacity for, the director told me at one stage, something like 20 years. And we needed a new Central Mental Hospital, and that has happened. And there have been an increase in beds. But the one thing we knew was that because of the waiting lists in prisons and outside, because it's not just people from prisons, even though you do have to have been before the courts, that are admitted to the Central Mental Hospital, we knew equally that there were people in the Central Mental Hospital that had been there for, a long time. And it's not just people in prison whose families are affected, but equally people within that system. So one of the things that we recommended as well was that there would be regional units where, for instance, people from the Central Mental Hospital, who, for instance, are from Cork and Kerry, would go to that unit, make it easier on their families. It was probably a lower level of security. And we recommended 3 of those. And the capital programme, and that's where money plays such a vital importance. The capital programme, which I now see has increased dramatically, is part of that planning process. You know, where they're going to be. We probably have institutions that already exist there, but now don't do the job that they were originally built for, with reconfiguration that maybe could play a part in that, even though sometimes local history tells people that, you know, that they don't want to go near there. But, you know, that is hugely important, that those sites would be developed, and that we would have that sort of true flow in relation to, because having people in prison that have difficulty with their mental health and difficulty with addiction and their mental health condition on top of that is not just a difficulty for the people themselves. It's equally a difficulty for the staff. You know, we kept very clearly in mind, and Karen will know this, we kept very clearly in mind the fact that, you know, people join the prison service to become officers within the prison service. They're not psychiatric nurses, you know, they're not psychologists. So we have to be very conscious of the workforce as well. They do their best, and they do their very best, but nevertheless, that's not what they signed up for. We recommended a training scheme in relation to Gardaí, because they are the first responders when it comes to issues like this. They are the first responders, whether it's someone that's, shouting and roaring in the street because of a mental health issue, whether it's someone that's strung out because of a drug addiction. They're the first responders. So we now have a pilot program running in Limerick, which is a collaboration between the Gardaí and the mental health services. And, you know, this is, I suppose, about bringing it all together. We never, in all of our discussions, and we met group after group, we met the education people, you know, we met the prisons, we met the judges, we met everyone. No one ever said to us, you need to create a different service. What they all said to us is that you need to get the services that exist to cooperate. And that's really what the task force is about. The other thing we recommended, Fiona, and I won't go on too much longer than this, the other thing we recommended, which will be part of the capital build as well, is that quiet landings, you know, that entry into prison with someone that has a difficulty, quiet landings, drug-free landings, violence-free landings, you know, and these are the recommendations from the task force. But can I just throw in something that I have a little bit of a bugbear about? I keep just one. I keep hearing that we have a prison population of 4,500, which we have, and going up. Do we continue to build more prisons, or do we start reducing the prison population? And the way to start reducing the prison population is by diversion. And the task force is first. It's a 3-part program, and its first part is on diversion. Diversion for people who shouldn't be in prison, who should be diverted to a different service. So do we reduce the population, or do we build more places? I would say that we should reduce the prison population, but that's my bugbear. We had 21 Gardaí, by the way, recently graduate from a mental health first aid course. And that's part as well of what the task force recommended. So I congratulate you on your report. As I say, for those of us who have been mired in it, we haven't, it's nothing, but it's nice to see that there are other people shining a light on groups of people who very seldom get to have their own voice, and very seldom get the empathy, respect, or sympathy that they deserve. So thank you very much for having me.
Thanks so much, Kathleen. And yeah, I think so. Just to say to everyone, obviously the executive summary is a very, very short, brief overview of the rich content in the report. And there's a whole chapter on the perspectives of people either in prison trying to access services, or people working, so prison officers, GPs, nurses, and a huge amount of quotes that are all in the full report. And I think that the thing for me that was really interesting was the solution focused, low cost or you know, cost neutral ideas that were being put forward by the men that we met and we spoke to. But actually on your point, Kathleen, I had this down to ask James just your opinion on the thoughts about the recent media reports about, you know, plans to just increase the bed numbers and capacity in prisons. What's your opinion on that, James?
Yeah, well, I recently put my name to an open letter that was published in the Irish Times in objection to that, because, as Kathleen said, anybody in the know knows that that's not a good idea. And I don't like, will we ever have in Ireland where we have evidence-based policies rather than just the usual tough on crime, longer sentences, just rhetoric that's boring and old and doesn't work, and have informed discussion and evidence-based policies? Do you know, why not have that? Why is it always this? It's tough on crime, bigger sentences. I suppose Kathleen touched on a lot of it there, but you know, last year I was able to address a lot of secretary generals of different departments, and I was explaining to them that it's not just on the Department of Justice to be dealing with the people that go to prison, because a lot of these people are failed by the Departments of Education, the Departments of Higher Education, the Departments of Health, the Departments of Housing, but it's the Department of Justice that has to deal with them. You know, like we met during Mental Health Week, we spoke in every prison in Ireland, but what really stood out for me was speaking with the women in Limerick and in the Dorcas. Some of them are on innocuous charges, small misdemeanors that have small bail, but they don't post bail because they have nowhere to go. They feel safer where they are. And you expand the prison estate, we all know who's going to be filling those spaces. Like they were talking recently, the minister were talking about harsher sentences for knife crime. And we know knife crime is bad, but we also know harsher sentences are not a deterrent. And if harsher sentences were a deterrent, why don't we have harsher sentences for road fatalities when they're through the roof? Because we know the type of person, the demographics of the person involved in knife crime is going to be a certain type of a person, whereas road traffic will be more general. So you build prisons, and we know who's going to be in them: people from council estates, travellers, homeless people, and people with mental illnesses. That's what's going to happen. And it's just going to, you're trying to use prison as like a solution to failed general social policies. So there's no like simple answer, but building prisons is definitely not the answer. Maybe there's an argument for a growth in population, but then you look at this report, 50% of the people in prison, over 50% have some form of a drug addiction. So you have a better drug policy. So we don't have that many people in addiction in prison. Something like in Holland, where they're actually closing prisons because they have such reduced numbers, because they have sensible drug policy. Do you know what I mean? So like one of the ladies in the dock said something and it really stood out to me. She says, James, prison, Mountjoy is the only place that does not turn me away at the gate. I get thrown out of hostels, I get turned away at the doctors, I get turned away everywhere. When I turn up at this gates and handcuffs, they never say no, not today. And that's a very sad indictment on society, where people go into prison and that's the only place they feel safe. They go into prison, it's the first time they uncover a talent or they start on an education journey. And that's a very sad indictment on society. And we want more prisons. For why? So we mask all the other failures and other policies. So I'd be very strongly in objection to that. And I'd love to hear the rationale behind it, other than what tough on crime, harsher sentences, because there is no real rationale behind it or sense to it.
Thanks for that, James. And I know Julia said it in her presentation that we didn't go in and meet women in the DOCAs as part of our research, but we did go in and have a tour and meet with the ISM officers and the assistant governor. And we're looking forward to reading Anne-Marie's PhD, which focuses specifically on this area. But I think that point around kind of the social determinants of health and the other departments that are involved is really important. And on that, Karen, sorry, I know I'm jumping around a little bit now.
Sure. Could I just, because I have to go now.
Yeah.
The 30 people that sat around the table with the high level task force included the Department of Housing. It included the Department of Social Protection. It included GPs. It included all of the things that you and I expect to encounter in our everyday life, because that's what we must start convincing people of. These are people that have exactly the same wants and needs as the rest of us. And that is hugely important. And, you know, I think it is important as well to say that, you know, that people that have difficulties with their mental health and people that have addictions to things, they do commit crime. They do. But we just need to discover, is prison the best place or is diversion the best thing to do? And in the task force report, it clearly came down on the side of diversion, and that's why we have the pilot program running in Limerick. So, and the other simple things, simple little things, is no one gets released on a Friday because all of the state agencies are closed. So it has to be other than that. And we have to equally, Ber, ensure that the journey out of prison doesn't end up back at the prison door, that the supports are put in place. And again, that's one of the task force recommendations. So I would agree with James, but on the other hand, the project, the building project that is now clearly being undertaken, there is a place for that. And the place is to transform what we have in order to ensure that people who have difficulties in prison are treated properly. If they have to be in there, they should be treated properly. But hopefully we will divert more away than we put in. So thank you very much for having me. As you know, Ber, I have to go now. So listen, it's been a pleasure, and I'm sure we'll meet again.
Thank you so much for joining us, Kathleen. We really appreciate it. Not that I know all 100 recommendations of sharing the vision off by heart, but recommendation 55 is around diversion, and we know there is work going on with that. And Minister Mary Butler, Minister of State for Older People and Mental Health, it links in really well with mental health reform, and we're always so grateful for that. But because of that reach across the departments, that's why we reached out to Minister for Justice Helen McEntee and asked her to do the kind of opening piece on this. So Karen, I'm going to come back to you really quickly. I'm conscious of time, but I just, on that piece around, obviously with the high level task force, different departments were brought together. How do you see that going forward, and how important is that for you as the Director General of the Prison Service?
Yeah, I think James has made a lot of the points already, as has Kathleen. And I mean, everybody in prison returns to their community, and in many cases, as James very eloquently put, the factors that gave rise to the offending behaviour in the first place, you know, are because of trauma, they're because of addiction, they're because of mental health issues, they're because of low levels of educational attainment. So whilst we can do a really great job with people while they're in our custody, because we can provide all of those services in a one-stop shop, I suppose what's difficult for people to navigate when they leave prison is trying to access those services. And James, that was a really poignant point you made about that lady and the DOCA Centre. So certainly from our perspective, we work with other statutory and voluntary agencies in terms of the through the gate piece. And I know, you know, the organisations like IASIO and Care After Prison perform a phenomenal job in terms of helping people to navigate that journey. So we have arrangements in place with social protection, working as hard as you can with housing, you know, making sure people are going out with the social welfare, access to a social welfare payment, to a medical card. But I think the Citizens Assembly on Drugs, maybe, you know, on their recommendation, which is that a whole of government and a whole of society response was actually required to do with drug addiction. And I would say it's the same in relation to criminal justice, that it can't be, as James said, the onus on one government department, you know, to address all of the root causes of offending. It does take a whole of government, but also a whole of society approach. And I think that's why the community and the voluntary sector are so important, not just in the context of the work they would do within prisons, but the work that they do within within their own communities. And there's many, many excellent examples. And I know some of them are referenced in the report. Bedford Row I'd give as one example, you know, in terms of providing services to people and the families of people in custody and people leaving custody on their return to their communities.
Perfect. And I think that the other thing as well is, I suppose when we're looking at all of the improvements and the changes that need to be made, it's about, you know, creating safer communities for everyone, you know, that early intervention and prevention piece as well, to try and divert people away from decisions that might lead them into accessing the criminal justice system, and but then also others across our communities and across the sector. Sorry, something came into my head there and it just popped straight back out. So I just want to come to John. John, I'm going to give you the last word on the panel of, if I could give you a magic wand and there was one or two things that we could change kind of overnight to improve mental health services and supports for people in the prison systems across Ireland, what would those one or two magic wand things be?
Well, I think it kind of resonating back to what James has said as well in relation to, you know, moving away from building more prisons and putting more funding in relation into the community. I think, you know, as we talked about, when we look at the services that are provided within the prison service themselves, I think it's very sad that that's where you find your educational journey. Like, that's where I found mine. I think we need to, like the larger organizations, like the Samaritans and the Red Cross, I was very heavily involved with them. And of course, they're very, very well known and they're excellent organizations. I was a listener with them. But I think the other smaller organizations within the smaller communities need to get funding and need to get recognition in relation to what's happening out there for them as well. I think the emphasis and the onus on those organizations and the communities to develop the educational pathways for people, because for me it was the journey out of a life that I didn't want and has brought me something new. I think if we could change something overnight, I think it would be to look at the value of it. Like, if you have a criminal record, now there are other options available for individuals. You know, it's no longer a hopeless situation. So there has to be a scenario developed, promoted and engaged with that shows people, okay, the stigma, we will remove it, we will battle it, but there will be an educational piece or there will be a job piece that will be there for you, clear structures that will be there for individuals.
Yeah, and I think it's so just on the report as well, obviously we focused kind of the mapping and the internal pieces, but there is that wider piece then of when people are exiting prison and the supports and community supports. And just to mention, I know Hale Housing are one of our members as well, which have the really great supported housing schemes. And yeah, I think that's why, like, you know, the underlying message in a lot of this is around the great work that our members do as mental health reform. And, you know, we need to make sure that there's kind of sustained multi-annual funding to keep them all going, because, you know, the difference that's made on the ground is huge. I'm going to pass over to Michelle, who is, as mentioned, the chair of our board, but also the executive director of Care After Prison, which has been mentioned a couple of times. So, and Michelle's going to be doing all the official thank yous. So I'll be quiet, but I really, really enjoyed the panel discussion. So the rest of us can turn back off our cameras and mute ourselves, and we'll hand over to Michelle and Orla or Catherine as the ISL. Thank you so much, everybody.
Thanks, Bear, for that. I just want to reflect on some of what the speakers have spoken about over the last hour or so. And a lot of it resonates with Care After Prison, because we actually go into the prisons and we see at first hand, you know, the issues and the challenges that the prisoners are undergoing. And specifically those who have just transitioned into prison can be a very traumatic experience, both for them and their families. And what we have started to do is actually deliver our peer mentoring program within the prison. And the purpose of that is that those mentors would actually mentor individuals coming into the prison in order to give them support and also be the point of contact in relation to understanding what the processes are within the prison services. And that is proving to be very fruitful. Obviously, we would like to expand that piece of work into all prisons, but for the moment we have it in one. And it is when particularly young people coming from Oberstown into Wheatfield experience the biggest huge challenges in relation to that integration into adult prison life. Other things that I'm delighted to hear from Karen, you know, that the educational video in relation to addressing people going into prison and for their families will shortly be launched as well. And I think that's hugely important, because for families, the experience of having a loved one being incarcerated can be very traumatic, not just for the partner, but also for the children, and how to support those children, because the stigma that is associated with a parent going into prison and the isolation that causes for the children as well. The other thing we also do is we also look at when people exit out of prison, and that again can be another traumatic experience, albeit that they are delighted to come out of prison and that their sentence has been served. There is the reality that things have moved on, people have changed. You know, for some people, if they have been in prison for a couple of years, you know, life moves very, very quickly and very swiftly. So there is a readjustment in relation to coming back and reintegrating into society and back into their community and into their family lives. So relationships have to be rebuilt. So as part of our service, we actually build on those relationships for those coming out of prison, and to try and work with the family members as well, so that the integration can be as smooth as possible. Today's event has been, you know, hugely inspirational, but also highlights the real need of having appropriate mental health services, not just out in the community, but within the prison service. And I am hopeful that from this particular report, that things will move forward. And I do believe that the not-for-profit sector has a huge part to play in partnership with IPS. And I think if we can really get around the table and see what each organisation can offer to support those challenges that are faced within IPS, I think we could have a different sort of prison service, both supporting the prison officers as well as the prisoners themselves. And it was interesting to note that Kathleen Lynch mentioned the Gardaí with regards to mental health first aid. Just as a point of interest, some of our staff members who are people who live with lived experience have been trained in mental health first aid to support people coming out of prison. But obviously we would love to be able to be in a position to deliver that to the staff members in the prison services, and then ultimately to prisoners as well, which would equally help in supporting the mental health needs of those incarcerated. So I know people have been here for well over an hour, and I need to just wrap it all up. And so before we can conclude today's event, I just really want to express my appreciation to our panelists for their enlightening insights, and to everyone who played a role in bringing this critical research to life. A special thank you to our steering group, the Research Advisory Committee, and all past and present members. Your significant contributions have been instrumental throughout every stage of this project. I would also like to extend my gratitude to our staff at Mental Health Reform, both past and present, who are involved in this work, particularly Research Officer Julia Corrie, who I think you will all agree has done tremendous work in relation to presenting here today and also in the production of the report itself. Our thanks goes to the Director General of the Irish Prison Service as well. Your cooperation and perspectives on the mental health challenges faced within prisons have been invaluable to our research. We are deeply grateful to all the study participants, especially the men in custody. Your willingness to share your experiences and solutions has been essential in enhancing our understanding of mental health issues in the prison system. Additionally, our heartfelt thanks to the HSE for their consistent commitment and financial support, which made this research possible. As highlighted in today's discussions, this report offers a unique view on the state of mental health in prisons. Addressing these needs requires a comprehensive approach involving multiple stakeholders across government levels, and this is particularly crucial for effectively supporting the mental health of those in prison. And on that note, I would like to sincerely thank you all for your presence here today and for taking the time out to what is a really important issue right across the country, and your commitment to mental health issues, both in the community and in prisons, is much appreciated. And we look forward to working with all of you in the not so distant future. So thank you, and I wish you well.